let us move on with the next talk. I shall be speaking about the effects of litigation on medical profession. And before I like to proceed further, my sincere thanks to Dr. Deshpande for his constant guidance to me as far as the medical legal issues are concerned and in all my presentations. The Supreme Court stated that medical service is a service industry. The medical profession came within the ambit of Consumer Protection Act because of the landmark decision of Supreme Court in the case of IMA versus VAP Shanta and others. So till the decision of the Supreme Court, the medical profession was a healthcare industry. The Supreme Court decision in this case, which brought the medical profession within the ambit of Consumer Protection Act that changed a family doctor to a corporate hospital. The impact of this was, the judgment was a significant step in expanding the scope of consumer rights in India, especially with regard to medical treatment. It reinforced the idea that consumers, that are the patients, have the right to seek redress in case of medical negligence, making it easier for the patients to file complaints and seek compensation in consumer courts. This ruling also led to greater accountability in the medical profession, pushing healthcare providers to maintain higher standards of care and professionalism, knowing they could face legal consequences for medical negligence. So, an unsatisfied patient, when the patient becomes unsatisfied and goes in litigation, maybe because of poor clinical results, behavior of the doctor, behavior of the staff, including the ambience in your setup, instigation by some people, and also frivolous complaint to earn some money. A patient can file for deficiency of service in any of the following. He can go to the consumer forum, or a civil suit in a civil court, a criminal court in the case, if he can go to the criminal court, and he can approach the Medical Council of India or a state medical council, or sometimes through politicians, ministers, member of parliament, or members of the assembly. Or they can approach even the bureaucracy, like the director of the deputy director of the medical or health services. So under Consumer Protection Act of 2019, there is the CPA, the doctor or hospital is sued for negligence under clause 35, for standards of services again 35, product liability action clause 22, 34 and 35, and not for complications. Complications are not conceded by the court. The complications can occur to anybody, and that leeway is given, which are mentioned, the complications that are mentioned in the research papers and in the textbooks, they are not held accountable against the medical profession. So, Section IPC 45 of 1860, Section 304A, now called the Bharatiya Nyaya Sanhita 2023, has come under clause Section 1061, as Dr. Deshpande enumerated, that is causing death by doing any rash or negligent act. The table death is generally inquired under Section 304A, now BNS Section 1061, as Dr. Quresh Maskati pointed out, and an FIR is registered, but the doctor is not arrested, though it is a cognizable offense, it is a bailable offense. So the Supreme Court in the case of Dr. Suresh Gupta versus the government and city of Delhi in 2004, it is held that for every mishap or death occurring during medical treatment, the medical man cannot be proceeded against for punishment. So complications as a result are bound to occur in any situation, and for that the doctor need not be arrested. The impact of litigation, coming to the core topic of my talk today, litigation significantly impacts the medical profession, leading to increased stress, financial burdens, and potentially affecting patients' trust and doctor-patient relationships, with some doctors even facing career repercussions. So what are the effects of litigations we should classify for the doctors, for patients, and for the healthcare system? Impact of litigation for doctors, stress and burnout. The fear of lawsuits and the legal process itself can cause significant emotional distress, leading to increased stress, anxiety, and even burnout. Defensive medicine. The constant fear of litigation can lead doctors to practice defensive medicine, ordering unnecessary tests or procedures to protect themselves rather than focusing on the best course of treatment for the patient. Financial burden. Medical malpractice Lawsuits can lead to substantial financial settlements, legal fees, and insurance costs, placing a significant financial burden on the doctors. But as Dr. Gaurav said earlier, medical insurance is a must, is a requirement. All practitioners should protect themselves for professional indemnity to avoid such situation. That one product relieves so much of stress from your mind. So the impact of litigation for doctors, reputation is at stake. Even if a lawsuit is unsuccessful, the allegations of medical malpractices can damage a doctor's reputation and professional standing. Impact on career. Legal battles can harm a doctor's professional standing, affecting career advancement and opportunities. The court goes on, gives date after date after date, and you sacrificing your practice have to appear before the court for against all the summons, and that really impacts your mindset, impacts on your career. Burnout and depression. Physicians involved in malpractice suits are found to have higher rates of burnout and depression, as well as decreased career satisfaction. And loss of clinical privileges. In severe cases, doctors may lose their clinical privileges or even their license to practice medicine. The impact of litigation for patients is a loss of trust. Medical malpractice allegation can reduce the trust that patients place in their doctors, leading to skepticism and anxiety. Patient distress, apart from distress to the medical profession, the experience of being involved in a medical malpractice lawsuit can be distressing for the patients if they are on the right side. You have to understand the other end of the spectrum too, both emotionally and psychologically. And reduce access to care. Some doctors may avoid certain procedures or specialties due to fear of lawsuits, potentially limiting the access of care for the patient. And for the healthcare system, increased costs are associated with medical malpractice litigation, including insurance premiums and settlements, can increase the overall cost of the healthcare. Reduced innovation. The fear of lawsuits can discourage doctors from adopting new or innovative treatments, as they may be hesitant to face potential legal challenges. And impact on patient safety. While some argue that litigation can improve patient safety by holding doctors accountable, inducing extra involvement from the doctors, the other end of the spectrum, that it can lead to defensive medicine and focus on avoiding lawsuits rather than providing the best possible care. Thank you for your patient hearing.